Hello everyone. Welcome back to Easy English Hub for a very special, in-depth lesson. Today, we will cover a very important topic at the hospital. This will be a full, 1-hour guide. We will cover everything you need to know, from arrival, to talking with doctors and nurses, to getting medicine. We will go slowly and explain everything clearly. This lesson will help you feel more confident in a medical situation. Let's begin our detailed journey. Part 1. Arrival. You have just arrived at the hospital. The first thing you might need is the main desk. This is the reception or information desk. You can ask, "Excuse me, where is the reception desk?" If it's an emergency, you need the emergency room. In the UK, it's called A&E, for accident and emergency. You can ask, "Where is the emergency room?" Another person might ask, "Are you here for an appointment?" An appointment is a scheduled meeting. Or they might ask, "Is it an emergency?" Knowing these first key locations is very important. You may need a specific part of the hospital. These are called departments or wards. For example, if you have a heart problem, you need the cardiology department. Cardiology is the study of the heart. For children, you need the pediatrics department. If you are having a baby, you go to maternity. For skin problems, you need dermatology. For bones, like a broken arm, you might need orthopedics. To ask, say, "Excuse me, I am looking for the pediatrics ward." Or simply, "Where is dermatology?" The hospital is big, so don't be afraid to ask for directions. At the reception desk, you will register. You can say, "I'd like to see a doctor, please." If you have a scheduled time, say, "I have an appointment with Dr. Smith at 2 p.m. The receptionist will ask for your name. "What is your name?" They will ask for your personal details. "Can I have your ID, please?" ID is your identification card. They may also ask, "What is your date of birth?" and "What is your address?" It is good to have these documents ready. Next, let's talk about insurance. The receptionist will ask, "Do you have health insurance?" Insurance helps pay for your medical costs. You can answer, "Yes, I do. Here is my insurance card." Or, "No, I don't. I will be paying myself." Paying yourself is also called paying out of pocket. You may also need to fill out a form. A form is a paper with questions. It will ask for your personal details again. It will also ask about your medical history. Medical history is your past health problems. For example, it might ask, "Do you have any allergies?" After registering, you will go to the waiting room. The receptionist will say, "Please take a seat in the waiting room." And the nurse will call your name when it's your turn. Sometimes you have to wait for a long time. You can ask, "What is the estimated wait time?" Estimated means approximate or about. While waiting, a nurse might come to do a basic check. This is called checking your vitals. Vitals are your basic body functions. They will check your temperature, and your blood pressure, and maybe your height and weight. Part 2. Describing your problem. The nurse or doctor will ask, "What seems to be the problem?" Or, "What brings you in today?" You can start with a general phrase. "I don't feel well. I feel sick. I think I need to see a doctor." It is very important to describe your symptoms. A symptom is a sign of illness. Be as clear as you can. Let's learn how to describe different symptoms. Let's start with describing pain. The doctor will ask, "Where does it hurt?" You can point and say, "It hurts here." Or you can use the structure "my" hurts. "My head hurts." "My stomach hurts." "My throat hurts." You can also say, "I have a pain in my." "I have a pain in my chest." "I have a pain in my lower back." Describing the type of pain is also useful. A sharp pain is sudden and strong, like a knife. A dull ache is a constant, not so strong pain. A throbbing pain feels like a heartbeat in the painful area. Doctors use a pain scale to understand how bad the pain is. They will ask, on a scale from 1 to 10, with 10 being the worst pain imaginable, how would you rate your pain? You just need to give a number. It's a 4. This is mild pain. It's about a 7. This is moderate to severe pain. It's a 10. This is very severe pain. They may also ask about the timing. Is the pain constant? It never stops. Or does it come and go? It stops and starts again. Giving these details helps the doctor understand your situation better. Now for cold and flu symptoms. These are very common reasons to see a doctor. I think I have a cold. I might have the flu. You can say, I have a fever. A fever is a high temperature. I have a cough. This is when you force air out of your lungs noisily. I have a sore throat. This means your throat hurts. I have a runny nose. This is when liquid comes out of your nose. I have a stuffy nose. This is when you can't breathe through your nose. You might also say, I have the chills. This is when you feel cold and shiver. And, my whole body aches. This means all your muscles hurt. Let's talk about stomach problems. Many people go to the hospital for stomach issues. You can say, I have a stomachache. Nausea is the feeling that you are going to vomit. You can say, I feel nauseous. Vomiting is the action of throwing up. You can say, I have been vomiting. Diarrhea is when you have to go to the bathroom very often. The opposite is constipation. Constipation is when you cannot go to the bathroom. You might also feel bloated. Bloated means your stomach feels full of gas or air. These words are very helpful for the doctor to know. Now for injuries. An injury is damage to your body, often from an accident. I had an accident. I fell down. If you cut your skin, you say, I have a cut. If it's a deep cut, it's called a wound. You might say, I am bleeding. A bruise is a purple or blue mark on your skin from being hit. A sprain is when you twist a joint, like your ankle or wrist. I think I sprained my ankle. The most serious is a broken bone or a fracture. I think I broke my arm. These words help the doctor understand what happened. Part 3, the examination. The doctor needs to ask you some important questions. Listen carefully to these questions. When did the symptoms start? You can answer, they started this morning. Or about a week ago. Are you allergic to any medication? This is a very important safety question. Allergic means you have a bad reaction to something. You can say, yes, I am allergic to penicillin. Or, no, I don't have any allergies. Another question, are you currently taking any medication? Medication means medicine. This helps the doctor avoid giving you drugs that interact badly. During the physical exam, the doctor will give instructions. Please roll up your sleeve. Let me take a look. I am just going to feel your stomach. Tell me if it hurts when I press here. To listen to your breathing, they use a stethoscope. They will say, please take a deep breath. Hold your breath. Okay, you can breathe normally now. To check your throat, they might say, please open wide and say ah. Following these instructions helps the doctor do their job properly. Sometimes the doctor needs more information. They may order some tests. A very common test is a blood test. The nurse will say, I need to take a blood sample. They will use a needle to draw a little blood from your arm. If you have an injury, you might need an X-ray. An X-ray takes a picture of your bones. The doctor will say, we need to get an X-ray of your wrist. Another test is an ultrasound. This uses sound waves to see inside your body. It is often used for stomach problems or pregnancy. More complex tests include a CT scan or an MRI. Part 4. Understanding the diagnosis and treatment. After the exam and tests, the doctor gives a diagnosis. The diagnosis is the name of your illness. The doctor might say, "The results are back. Based on the symptoms, it seems you have the flu." The X-ray confirms that your leg is broken. It's a simple viral infection. It's okay to ask questions. You can ask, "Is it serious? What is the treatment? How long will it take to recover?" To recover means to get better. The doctor will then explain the treatment plan. Treatment is what you do to get better. The doctor will give you a prescription for medicine. A prescription is a written order from a doctor. They will say, "I am going to prescribe some antibiotics. Antibiotics are for bacterial infections. I will also give you something for the pain. This is a painkiller." The doctor might also give you lifestyle advice. You need to get plenty of rest. You should avoid strenuous activity. This means no heavy exercise. Drink plenty of fluids like water. Part 5. At the pharmacy. You take your prescription to the pharmacy or drugstore. The person who gives you medicine is a pharmacist. You go to the counter and say, "Hello, I'd like to fill this prescription." To fill a prescription means to get the medicine on the list. The pharmacist will prepare your medicine. They may ask you to confirm your name and date of birth. This is for safety. Can you please confirm your name and date of birth? Then you will wait for them to get your medication. It is very important to understand the medicine dosage. Dosage is how much and how often you take the medicine. Ask the pharmacist, "How should I take this?" The label on the bottle will have instructions. Take 1 pill 3 times a day. Take 2 tablets with water. Ask, "Should I take this with food?" With food or after meals means you eat first. On an empty stomach or before meals means you take it before eating. Also ask about side effects. Are there any side effects? A side effect is an unwanted problem from the medicine. For example, this may cause drowsiness. Drowsiness means feeling sleepy. Let's learn the names for different types of medicine. Pills or tablets are small and solid. You swallow them. Capsules are similar, but they have a plastic-like shell. Syrup or liquid medicine is a liquid you drink. It often comes with a small measuring cup. Cream or ointment is something you rub on your skin. It's for rashes or skin injuries. Eye drops are liquid you put in your eyes. An inhaler is a device you use to breathe in medicine. This is often for asthma or breathing problems. Knowing these words helps you understand your treatment better. Sometimes, your illness is serious. The doctor might say, "We need to admit you to the hospital." To admit means you will stay in the hospital. You will be a patient in a hospital room. Your room will have a call button or call bell. You press this to call for a nurse. You might have an IV drip. An IV drip is a bag with a tube that puts fluids or medicine directly into your vein. There are also visiting hours. This is the time when your family and friends can visit you. Visiting hours are from 2 p.m. to 8 p.m. Part 6. Leaving the hospital. When you are ready to leave, you are discharged. The doctor will say, "You are being discharged today." Before you leave, you might need a follow-up appointment. You can ask, "Do I need to schedule a follow-up?" A follow-up is a future appointment to check on you. They might say, "Yes, please make an appointment for next week." You will also need to pay the bill. You go to the cashier or billing department. You say, "I'd like to pay my bill, please." They will tell you the total amount. Finally, it's polite to show your gratitude. Gratitude means being thankful. Before you leave the doctor's office, say, "Thank you very much, doctor." You can also thank the nurses. "Thank you for your help." The doctor or nurse will often say something nice to you. Get well soon. Take care of yourself. We hope you feel better soon. These are kind wishes for your recovery. And with that, your hospital visit is complete. Wow, that was a lot of information. Excellent job making it through this entire lesson. You have learned so many essential phrases for the hospital. From registering, to describing pain, to getting medicine. This knowledge will make a difficult situation much more manageable. Remember to review these phrases. Thank you for your dedication and for learning with Easy English Hub. We wish you good health always. Please like, share, and subscribe for more detailed lessons. Take care, and see you next time. Goodbye.